Beth.
Thank you. Have you ever considered how strange it is that we have our modern day healthcare system? It's an employment-based system. How did we get it? Well, there was 4 accidental steps that brought us here today, as discovered by the people at NPR News and This American Life. So, first, step 1, get rid of the leeches. Before 1909, doctors still used leeches to cure medical problems. Before 1909, medicine actually just covered over symptoms instead of actually curing anything. But 1909 was the magic year that Alverson was created. It was a drug that actually cured syphilis, which meant you were sick one day, you took the drug, and the next day you were cured. This was a breakthrough for medicine. So step 1, cure diseases. Get rid of the leeches. But in the 1910s and the 1920s, doctors started going to training. They started having to go to medical school, get licenses. Hospitals changed from places where people who were desperately poor went to die to places where people had babies and went to get better. All of this improvement cost money. Before 1909, people paid only $5 to be cured from their illnesses. Of course, it might kill you, but at least it was cheap. But as all of this grew and people became better and better at curing people, it became more and more expensive. So this brings us to step number 2. Find a way to pay for it all. A healthcare administrator in Texas noticed that people spent a few cents every week on things like lipstick. But they didn't have enough money to cover the large hospital bills. This brought him to the idea of health insurance. He went to a group of school teachers and said, listen, you pay me $6 a year, I'll give you 21 days of coverage. Anytime you need to go to the hospital, 21 days, you can have 21 days of hospital coverage. So they thought this was great. It was only $6 a year, which is only 50 cents a month, same as price of lipstick. And he knew he was getting a really good deal because think about it. People who are healthy enough to work are probably not very sick. Now, the idea began to spread around the country, and slowly, lots and lots of different hospitals began to implement this. This is now called Blue Cross. Step number 3, have a Great Depression. Because the cost of health coverage was expensive, and the Great Depression made people even more and more poor, hospitals all over the country began to have to use this health insurance because people just could not afford to go to the doctor unless they were dying. Now, health insurance grew and grew, but the real thing that helped it really get big at that time was the World War II. World War II brought the government to impose a cap on all wages. Employees could no longer raise wages to attract people. Meanwhile, you can see from the picture, all of these people were going overseas and getting shot and killed, and there was less and less people actually here in America to do the work. So what is a poor company to do? Well, what they did was they realized they could increase the benefits, like health insurance, and they did other things like life insurance also. So more and more companies took advantage of this to lure in the last few employees that were around and weren't over getting bombed. So now this brings us to this 4th step in our accidental way to get to our modern healthcare system, which is the favorite group of everyone in this room, the IRS. So the IRS got a query one day in 1943. It said, do I need to pay taxes on this insurance policy that I'm paying for my employee? Well, the IRS was like, nah. So they filed a little tiny inconsequential filing that said employers do not need to pay tax on their employees' health care premiums. This was just something they did without even thinking about it. But by 1954, the whole United States was rallying, and all the companies were saying, Congress, make this law, make this law. So in 1954, the Congress passed the IRS code that there was no taxing on the healthcare benefits, which is the final step in our modern healthcare system. So, if you don't believe that this final step had a big impact, let me show you the data. In 1940, only 9% of U.S. people had health insurance. By 1953, it had gone up to 63%. So you can see here, it's a huge impact on our system. So there was 4 accidental steps that brought us to our modern healthcare system. The next system that we have needs to be architected very, very strategically and carefully. Thank you.